Good morning and welcome to the webinar. My name is Beth Davison and I'm a broker advisor at Cornerstone. Today I'm joined by our representatives from Anthem Ohio for a review of their fourth quarter and 2024 updates. If you have any questions throughout the presentation, you can leave them in the question box on your GoToWebinar dashboard. We will address all questions at the end of the webinar. My information is on the screen if you'd like to get in contact with me, and don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you are not currently subscribed. The AGB portal is your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commission schedules. If you have any questions about the platform and your access, please reach out to your broker advisor or the AGB support team at agbsupport@crnstone.com. With Cornerstone's Agency Services Program, you are the pilot of your business and we are your flight crew. As a Cornerstone broker, you have access to expert services from our Agency Services Program that can help you with business outside of your scope and planning for the future. We will create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Contact your Cornerstone representative for more information. And now I'll turn it over to Kathy and Robin.
Great. Thank you, Beth. I'm All right. Can everyone see the presentation now?
Sure can. Yes.
Awesome. Thank you. So I want to take a moment to introduce our presenters today. Myself, I'm Robin Kalp. I'm an account manager in Southwest Ohio, and I'm kicking off the presentation. Kathy Shiplet is our sales executive, and she will be covering the product updates. So here's a snapshot of what we will be talking about today: tools and resources available to you and our members, portfolio updates, specialty updates, and renewal reminders. We are a national company with a commercial presence in 15 states with over 48 million members. We are the largest player in the market, and that's what matters. We're not just big because of who we are as Anthem, but because we are a part of the Blue system with over 100 million members served. Why does being big matter? Not only can we negotiate the best discounts, but providers and healthcare systems want to partner with us on the value-based programs and digital adoption because we have the largest market share and the member population. So here on our local level, we have been a community of partners for 80 years. We serve over 3 million members and have made more than 6,000 associates who live and work in the communities that we serve. You asked, we listened, created, and developed the Broker Launchpad. We're extremely happy to bring this to you. It provides easy one-stop access navigation to get what you need in an instant. It shows a quick description and preview and includes a link to each and every tool. It shows you when to use each tool during your daily journey. This is a great resource for new hires and any current employee as well. Based on your feedback, we've been busy making improvements to the producer toolbox as well. You'll notice less forms during the onboarding process, the elimination of separate employer access accounts, as well as simplified experience when managing and quoting your books of business. As I'm sure most of you have a cell phone with you right now, I wanted to remind you about the Broker Plus mobile app, which is essentially the broker producer toolbox on the go. If you haven't already downloaded the Broker Plus app, now's your chance. You can scan the QR code on the right of the screen. It's the easiest way for you to stay up to date on your broker news. The Anthem Broker Hub is your source for the latest broker news and all the marketing materials you need to sell and renew your business in all of our 15 states. You can share marketing materials from the site instantly with your clients or your team, which makes your life a lot easier. Employer Access. It is our site for the groups to manage their plan and even their marketing resources from themselves and their employees. Our welcome campaign to both large and small group new employers include a message that calls out the importance of registering and using Employer Access. Let's look at the functionalities available to your groups on Employer Access as our one-stop shop for all administrative needs. You can process enrollments, use it for billing, member management, as well as administration, and all of the functions below. Something all our members have access to at no extra charge is our Sydney member app. It simplifies a member's healthcare journey, allowing them a single point of access to their benefits, tools, and resources. And you don't have to just take my word for it. There's the, I'm sorry, all of the awards that we've won for the Sydney mobile app. But the most one we are proud of is that we get a member starring of 4.7 from the members using the Sydney mobile app. Our Sydney Health app allows members to view their claims, get pharmacy refills, access virtual care, and most importantly, view their digital ID card. It's powered by AI, which enables it to become a more personalized experience each time a member logs in. Now let's talk about virtual care. We offer it to our members through the Sydney app. The virtual care can help close gaps in care by providing wellness checks, management of chronic conditions, behavioral and specialty health appointments, and then urgent care on demand 24/7. Depending on the plan design, preventive and primary care is at low or no cost to members. Virtual care and the symptom tracker is just one click away. Via the Sydney Health app, members can access full wellness visits, behavioral health, which is a video-based psychiatry or psychology appointment, as well as prescriptions, since our K-Health providers can prescribe and refill medications. Anthem has identified that access to mental health treatment and support is a challenge and often leads to higher costs. Even when there are mental health providers, waiting times can be extremely long. Nearly 40% of our patients wait over a week. As a result of this barrier to care, we are increasing the prevalence of mental health and substance abuse disorders and the rate of the ER visits for mental health and substance abuse issues. It's increased 44%, driving the cost of care. So our Sydney Health app connects consumers to faster care on the mental health and substance abuse. 72% of our members stated that the virtual self-guidance has improved their emotional health. And then we have participants that save 16% of their total costs from participating in the benefit health management system. As you know, our pharmacy services are now called Carillon RX. This is a brand name change from Ingenio RX. We are committed to health, whole person health, driving performance with value, and creating a more cohesive and simpler member experience. I think we can all agree that the pharmacy landscape is changing. Just recently, some drug manufacturers have announced their intent to specifically or significantly lower the cost of medications, including insulin, effective January 1st, 2024. Some of these low-cost drugs will be added to our essential and national formularies, being pushed October 1st. And moving forward, our drug list changes will be made in January and July, where they used to be made in April and October. ZipDrug, allows our members with maintenance medications to receive their prescriptions hand-delivered to their home. Recent data has shown that Zip Drug allows us to move the needle where it matters. For the members utilizing this program, we've seen up to a 10% increase in medical adherence. All of this means improved outcomes and a higher level of member satisfaction. Now I will turn the presentation over to Kathleen Shiplett for the product updates.
All right, thanks, Robin. Next, I'm going to take you through some changes that are happening with our products for 2024. The IRS guidelines obviously have changed for 2024, and our plans will be updated to reflect all of the new minimums and maximums. And just so everybody knows, a copy of this presentation, I believe Beth will be sending it out to everyone that was registered for this training after the training is complete. So you will have this information available to you as a reference. One of the main reasons that we get together this time of year is to be sure that you are up to date on changes as well as any enhancements that we make from year to year. And all of your sales reps and the broker reps will have all of the details. Plus, you can find detailed marketing materials on our broker hub. But let's take a look at some of the most important changes that are coming your way for 24. First of all is the gene and cellular therapy. This is going to be managed like our transplant benefits. And you can see on the slide on the right-hand side, it outlines what products this applies to. And this is on all of our small group platforms, ACA, MIWAs, ABF, which is the Anthem Balanced Funding, and Grandmothered. So cellular and gene therapy is going to be managed as under the transplant benefits. Building Healthy Families is the program, used to be called Future Moms. Building Healthy Families is replacing it because we are expanding this program beyond just the pregnancy piece of this. And this, again, applies to all of our platforms. The RX home delivery copay multipliers are going to be reduced on ACA, MIWAs, and the ABF. Use of home delivery is now going to be opt-out instead of optional, and we are going to spend some more time on all of these items, so I'm just kind of listing them out and then we'll go into more detail. So the opt-out home delivery is going to be taking place on ACA, MIWA, and ABF. The RX Choice Level 2 pharmacy copays for levels 2 and 3, very confusing, lots of numbers, levels, and tiers. They're going to be increased to encourage the use of level 1 pharmacies. So we'll see that the copays for level 2 pharmacy for tiers 2 and 3 are going to be increased. And this is on the ACA, the SACA benefit plan. This would not apply to the Farm Bureau, and the Anthem Balanced Funding plan. Blue Connection HMO plans. We're removing the word link from the name in this plan. It's going to be the Blue Connection HMO. All of the benefits now have copays. There is no co-insurance plan designs. They're all going to be copay. And the PCP selection is optional. It is not required any longer that someone has a PCP selection on the Blue Connection HMO. And we offer Blue Connection HMO plans on ACA and on the SACA benefit platform. So first, let's talk a little bit about the opt-out home delivery. Members have up to 2 retail fills on a maintenance medication before they must notify Carelon RX of their choice for ongoing refills. They can continue using their participating retail pharmacy, and they can pay the retail copays, or they can switch to Carelon RX mail delivery or a CVS retail pharmacy where they can get the 90-day supply at the home delivery copays. Letters will be sent to members after their second 30-day retail fill of a maintenance medication, reminding them that they need to contact Carelon RX. This contact can be done via phone, anthem.com, or the Sydney app. All they have to do is to contact Carolina RX and have the choice. They do have the choice to opt out of home delivery. They can continue to use their retail pharmacy if they wish. They can sign up for home delivery or select the 90-day refill with CVS retail locations. Members can expect the first time home delivery order to take about 2 weeks, but then refills would only take up to 3 to 5 days. So if a member does not contact Carolina RX to make a selection and they go to the pharmacy to get their third refill of a maintenance medication, they will be responsible for the full cost of that medication. So it's going to be mandatory that the members reach out to Carolina RX to let them know if they want to continue retail. They can do that. We just need to have that decision on file. Our Wellbeing Solutions are designed to support the whole person health. Clients with Wellbeing Solutions packages showed up to a $58 per member per month savings in clinical savings. And our Wellbeing Solutions deliver an increase in member engagement, which is almost 4 times the amount of adults getting their annual wellness visits in over the programs that do not offer incentives. So we are seeing true, real results with our programs that offer the member incentives. There's a convenient access to care with these programs. The employees have quick access to expert support for their whole health, from behavioral health to needs for illness, injury, or even a hospitalization. And it's also administratively easy to manage all of their wellness solutions on the Sydney app. This is an outline. All of our programs offer the foundational package for Wellbeing Solutions. This slide is showing the foundational package, which applies to all ACA, and the foundational plus engagement 200, which is the incentives that members can use. That applies to MEWA and ABF. So the engagement package offers the rewards for doing wellness activities, preventive care, condition management. That is for our MEWA and ABF plan designs. This is an outline of all of the different programs that go into what we call our foundational program. Let's talk about some of the new programs and enhancements that are being made for 2024, and these are called out in green on your screen. We have added an enhancement for our behavioral health management called RISE. This is Resilience Through Information, Support, and Education, and it's an outbound engagement program for substance use and disorder. It uses predictive analytics to identify members at high and critical risk of having a substance use disorder related negative health outcome in the next 12 months. Case management outreach is made to members and provides one point of contact to address behavioral health, physical health, and substance use disorder needs. There are interventions including assessment, care planning, service coordination, and resource identification to reduce various negative health outcomes and spend. Our Healthy Life campaign provides targeted outreach to encourage members to close gaps in care or to address service opportunities in an effort to reduce cost of claims and emergency hospital visits. Our back and joint pain program is now providing knee and hip replacement, shoulder joint support. The back and joint pain management program offers personalized, non-surgical pain relief solutions with no wait time. This is an online program that helps to address the root cause of pain so your employees can be at their best. The back and joint pain are leading causes of disability. And this program simplifies complex processes of finding support for care for the back and the joint pain relief. Medical evidence is used to drive savings, prevent unnecessary treatment, and empower members. Using predictive analytics, Carelon identifies members that are experiencing back and joint pain or who may be at risk. Early identification allows for targeted outreach to members, and a digital clinic is supported by our vendor, Lavara. Lavara provides a 6-week online coaching program and focuses on daily exercise and education. Personalized exercise and support plans can help reduce the cost of related care to interventional pain procedures and spine surgeries. Our Cancer Care Navigators offers disease-centered care, increases access, and reduces unnecessary utilization to improve the outcomes. Utilization and case management are integrating to reach members optimally at critical points in their care journey through enhanced digital capabilities. We are also retiring the WebMD health assessment and migrating to My Health Check-in for 2024. This is a more efficient and consolidated assessment to get to know the members and connect them with our internal suite of tools. This assessment is 85% shorter and takes 75% less time than the health assessment that we have used for the last few years. And completing the health assessment is one of the wellness activities in the Engagement 200 program that members can earn rewards for. So we expect with this new tool being easier to use, taking less time, that this is going to increase the utilization of the tool. As I mentioned, we're replacing Future Moms with Building Healthy Families. Building Healthy Families is an end-to-end digital solution that goes beyond traditional maternity support to offer helpful resources from preconception through the stages of pregnancy, childbirth, early childhood, up to age 5 and beyond. The program includes many tools, including fertility, diaper change, feeding trackers, due date calculators, blood pressure monitoring, and it also offers high-touch member interactions and access to digital library of resources covering topics to support diverse families, including single parents and same-sex or multicultural couples. Experiences are personalized for each member and designed to connect them to useful resources to navigate every stage of their unique journey. And this program is available 24/7 on our Sydney mobile app. The Engagement 200 package is included in our MEWA and our Anthem Balanced Funding plans. This is for the subscriber and their spouse or domestic partner, and they can each earn up to $200 per year in gift cards by completing certain activities. And this can include claims-based preventive care, wellness activities, and condition care management programs. They're all listed on your screen along with the dollar value that is assigned to each one of the activities. This is a user-friendly program that is housed in our Sydney app. There are additional marketing materials that are available for you to share with your groups and employees. So if you want additional information on this, make sure that you're promoting it for your renewals as well as any new business. Make sure to get with your broker rep, or you can use our resource for marketing materials, anthembrokerhub.com, and there are additional resources, marketing materials available there as well. So as I had mentioned earlier, we are just removing the name link in our Blue Connection HMO plans. We have this Blue Connection HMO is available on our SACA benefit plan platform as well as ACA. With the Blue Connection HMO, this improves access to preventive care, leverages an all-in-one solution on the virtual platform, and it provides robust health support through virtual and in-person care. It also offers virtual primary care at no cost, and it empowers employees to seek virtual care for health issues right away, as opposed to waiting for an office visit appointment to become available to them. This does improve engagement in the member's existing care through the tools that are available. The Blue Connection plans are available in 3 metro areas in Ohio, these being Columbus, Cincinnati, and Dayton. The High Performance Network was curated specifically to meet the cost and outcome criteria. In the Dayton area, our high quality, high value partner is Premier Health and Dayton Children's. In this market, you can expect to see about a 16% premium savings based upon comparing to a comparable PPO plan. This is the highest savings that you will see in the state. So if you have business in the Dayton market, I strongly recommend that you take a look at the Blue Connection HMO plans. This can be offered side by side with any of our other plan offerings as a dual option, as long as you have 3 people enrolling, or you can offer a triple option, 3 plan designs, as long as you have 10 people enrolling in that group. But in the Dayton market, you will see about a 16% savings on the HMO compared to a PPO plan. In the Columbus market, our network includes Ohio Health and Nationwide Children's. And in this market, you can expect to see about an 8% premium savings over a comparable PPO plan. So again, you can offer this as a dual option or a triple option as a way for employers to offer some savings to their clients. In the Cincinnati market, our Blue Health Plan high performance network partners are TriHealth and Cincinnati Children's. And in Cincinnati, we're averaging about an 11% savings up against a comparable PPO. On our SOCA benefit plan platform, we also offer Blue Access Options, PPO, 3-tiered plans. If you see the word options in the name of a plan design, it is referring to our 3-tiered network. Employees can enjoy access to high quality healthcare with lower out-of-pocket costs, and groups can enjoy having a choice of a lower cost plan. The members can choose a provider from any of the tiers, tier 1, 2, or 3. Tiers 1 and 2 make up our in-network Blue Access provider network. Tier 1 is a listing of the preferred providers. So if a member sees a tier 1 provider, they will have more cost savings available to them, lower copays, lower coinsurance, less out of pocket to the member. Tier 2 is the remainder of our Blue Access network with the remainder of the providers that are considered in network. And tier 3 is out of network. Members can see doctors across any of these tiers at any time without referrals or approvals. This map indicates the service areas that are covered by the options 3-tiered plans. They are Cincinnati, Columbus, Cleveland, Dayton, Toledo, and Youngstown. A group must be located in one of these areas in order to enroll in an options plan. Members living outside of the service area would not have tier 1 providers available to them. Again, options plans can be offered as part of a dual or a triple plan offering. So if you have groups that have members that are outside of that service area, you can offer, they would have the availability to utilize the options plan, but they would only have the benefits of a tier 2 plan. You can offer a dual option as well for the members that are outside of that area. Some of our larger provider groups are pictured here that are part of tier 1. In the options plans, they are the Ohio State University, Tri-Health, Premier Health, Dayton Children's, Mount Carmel, University Hospitals in Cleveland, just to name a few. And this obviously is not all-encompassing. This is just calling out some of the larger provider networks. We are updating the language in our summary of benefits. This is not a change to the benefits. It's just making a change in how they are displayed. We're trying to make them easier to understand. And as I go through some of these, it's going to make sense to you what we're trying to do to clarify the benefits. So virtual visits will display more clearly to indicate that a benefit is for K-Health or Live Health Online. These are two different providers that we utilize for virtual visits online, and it will actually make it more clear any differentiators between K-Health and Live Health Online. The emergency room will only state your copay will be waived if admitted on plans where a copay exists. If it's not a copay plan, that language is going to be removed. Inpatient readmittance statement. If readmitted within 72 hours for the same condition, no additional facility copay is required. If transferred between facilities, only one copay will apply. And again, this is only going to be stated on the plan designs where there is a copay. The $50,000 out-of-network non-emergency ambulance benefit is going to be updated to show this is per trip. And the $0 copay for kids under 19 is going to be updated. And our new out-of-network, out-of-pocket statement will specify exactly what services are excluded from the out-of-network, out-of-pocket limit. So we're just trying to clarify some language on there to make it easier to understand. Some additional changes, substance abuse is updated. We are now using the terminology substance use disorder. A note is also going to be added, the limits for physical, occupational, and speech therapy, if any, for this plan will not apply if you get care as part of the mental health and substance use disorder benefit. Any reference to Ingenio RX is going to now state Carelon RX. And your cost share will be reduced when services are provided in a PCP's office is going to be replaced with, you will pay the PCP's office visit copay when services are provided in their office. And if no cost share is on a benefit, the cost share will read no charge versus what it says now, 0% coinsurance after deductible is met. Again, just a way to kind of help clarify what the benefits are and how the claims are going to be paid. Next, let's talk specifically about our MEWA plans. First up is our SACA benefit plan. We are offering 33 plan designs, including a couple of new plan designs that we're going to be talking about, Lean RX and Preventive RX. 2024 HSA compatible plans will no longer have a deductible applied to virtual visits on Live Health Online or K-Health. What this means is that the virtual visits will be at no cost, even on the HSA plans, as it has been on our PPO plans. So we're really happy that we were able to make this happen for the members that have HSA plans as well. And our RX home delivery copay multipliers have been reduced. So let's take a look at some of the most important changes for the SACA plans coming up in 2024. As I had mentioned, there will no longer be a cost associated with the virtual visits for Live Health Online or K-Health. Now, this does exclude specialty visits for Live Health Online because there are a lot of specialty visits that can be done through Live Health Online. So this is just for sick visits, PCP, that type of thing. So on our HSA compatible plans, there's no longer going to be a cost share associated with the virtual visits. for emergency services, it is now subject to deductible and a copay. Previously, it was copay and insurance on the copay-based plans. And the increased copay, there's going to be an increased copay on those copay-based plans. The pharmacy retail copays are adjusted to help maintain plan affordability. And the new cost-saving Lean RX plans. These are some plans that have copays for tiers 1 and 2, but then a 50% co-insurance on drugs that are in tiers 3 and 4. And we've added 2 new plans with the Lean RX. They are the Blue Access PPO 2500, 100% 7500, and the Blue Access PPO 5000, 0% to 9000. But no, Lean RX is included in the name of these plans. So that is what it's referring to. You will have copays for tiers 1 and 2 only. For tiers 3 and 4, those drugs will be covered at 50% coinsurance. Last year, we introduced a preventive RX plan on one of our HSA plans, and we are expanding that this year. We will be offering 2 plans that have preventive RX included. This is a list of RX copays there's a list of medications that offer copays, and it's only on a specific list of maintenance medications. So it doesn't apply to all prescriptions. Obviously, it's a list of preventive medications that they will have an RX copay apply. So in those situations, it would not be the full cost of the drug going towards that HSA deductible. The plans listed as discontinued are actually being updated and renamed just to reflect the new cost share updates for 2024. So you will no longer see the $3,000 deductible PPO plan, for example. That is being shifted to the $3,250 to make sure that all of our cost shares are in compliance. Next, let's talk about the Ohio Farm Bureau health plans. We offer 18 plans for the Farm Bureau, and we have also added the Lean RX and Preventive RX plans for the Farm Bureau. 2024 HSA compatible plans no longer have the deductible applied to the virtual visits, same as what we discussed for the Sakamiwa, and the RX home delivery copay multipliers are reduced. So again, with the Farm Bureau, we will have no copay assigned to virtual visits through Live Health Online or K-Health, and this does not include the specialty Live Health Online visits. The emergency services, the same changes have been made here, where it will be deductible and copay, and there is an increased copay on the copay-based plans. The cellular and gene therapies are now a covered benefit. This one only applies to the Farm Bureau because previously this was excluded in the cert language of the Ohio Farm Bureau. Cellular and gene therapies are now a covered benefit in 2024. And again, the retail pharmacy copays are adjusted to maintain plan affordability. We have the Lean RX plans that are going to be offered under the Farm Bureau as well, where you have copays on tiers 1 and 2 and 50% coinsurance on the medications that are in tiers 3 and 4. We're also including an additional preventive RX plan where there will be a list of preventive medications that are covered with a copay as opposed to the full cost of it going towards the deductible. Next, I want to touch on Anthem Balanced Funding, and this plan is something that is newer to the small group market. It's something we've been offering in our large group market for quite some time. We opened this up to small group earlier this year. So I'm going to talk a little bit about what this program looks like in case you missed the rollout or need a refresher on what this plan is. We have 20 available plans. We've also added Lean RX and Preventive RX for our Anthem Balanced Funding. We have removed the copay going towards the amount going towards a deductible for the virtual visits, and the RX home delivery copays are reduced. So we have some of the same changes going into effect on the Anthem Balanced Funding plan. But we want to talk a little bit about what this plan is. And historically, what we have experienced so far with the large groups that are on this plan, about 56% of our groups do get a surplus refunded to them at the end of the year. And the way we are positioning this level funded plan is that we want to renew and sell business. So if we are not competitive on other offerings, or if a group prefers a level funded product, please share these opportunities with your benefit advisor, and they will work with your Anthem sales team to get the quotes to you for the Anthem Balanced Funding. So we always start out with our MEWA rates. We always start out by quoting that platform, but we have the opportunity with ABF. It allows us more flexibility in our pricing for opportunities where we may be missing out due to our lowest filed rates with the MEWA. We don't have that situation with the ABF. The ABF is a payment arrangement that fits clients who are seeking a self-funded solution, but still have a fixed monthly payment and no additional terminal liability. Our plans offer the standard contract terms with a $25,000 specific stop loss. And I do want to point out, currently, that plan is a $20,000 specific stop loss that is going up to $25,000. We have 110% aggregate stop loss, 12/12 coverage period with terminal liability, and 50% of that group surplus can be refunded at the end of the year. In addition, we do have reporting that is available to groups that are on Anthem Balanced funded programs, so they can have reports getting an idea of what to expect as far as the surplus, where they're running, what that all looks like. So there is more transparency that is available with the reporting that is available on Anthem Balanced Funding. This is a look at what some of that reporting would look like. There is a quarterly report that is shown above that will be available to the account managers and provides valuable insight into how the plan is reporting, how the plan is performing. There's also reporting that is available on employer access, so the group has access to look at those reports at any given time. The product changes here are the same as what we have seen on the other platforms, with the virtual visits on HSA plans, emergency room service copays, pharmacy copays, adding Lean RX and Preventive RX plan designs. That is similar across the board on all of our platforms that we are offering for new business. We do have one plan that just needs to be updated from the $3,000 deductible up to the $3,250. That is the only plan design that we have with our Anthem Balanced Funding plans. Now with our ACA plans, as you know, we have said before, we offer you more options than any other carrier. In ACA alone, we have an additional 25 plans that are available. We will have reductions in the home delivery for RX copay multipliers. And with ACA plans, the benefit with this is there is no medical underwriting required. The rates are the rates since it is a community rated platform. We are no longer going to be offering our Engagement 200 package on any of the ACA plans. There were only a couple of select plans that included this package. It wasn't all of them, but we are discontinuing those plans. We will continue to offer the full Wellbeing Health Solutions foundational program as what we had outlined earlier. We just won't have the Engagement 200 benefits. So we are discontinuing some plans for ACA, one being Wellbeing Perks. Pathway Group HMO is being discontinued. This is different from the Blue Connection HMO. So our Pathway Group HMO plans are being discontinued. And we have cost share updates, obviously, on the plan designs to keep us within the regulations. The plans with Wellbeing Perks and the Pathway Group HMO plans that are being discontinued, anyone that is currently enrolled in one of these plans will be mapped to the closest available plan to them. We also have 4 ACA Gold plans that are being discontinued. And again, the groups that are enrolled on these plans currently are going to be mapped to the most comparable plan. And we have those outlined on this slide. And of course, we continue to offer our grandmothered plans for the legacy business to continue to renew. There is a base rate increase of 0% on our grandmothered plans, but keep in mind that group experience and demographic changes can still impact the overall renewal increase on any specific group. Some of the product updates that we have specific to the grandmothered plans. The first 3 plans that are listed above are being updated just to meet the IRS minimum deductible requirements for the HSA plans. We are also going to discontinue our plan year variants. They are being closed to reduce the administrative burden because there is no or low enrollment on those plans. So we are closing out 12 of the plan year plans with our grandmothered platform. Next, I want to touch on Anthem Specialty. When it comes to specialty coverage, our plans can go toe-to-toe with any of the standalone carriers because we offer broad network access, deep discounts, and meaningful product features. The real magic happens when Anthem Specialty benefits are integrated with our medical plans. Our patient data is connected between the different providers, delivering better health outcomes and lower costs. When combining everything with Anthem, members benefit through better care and better value and a better end-to-end experience. We are the first and only dental carrier with bi-directional communication between dentists and doctors, care management professionals, and with the patient health history capabilities. We have automatic identification and enrollment and notification of additional dental services for members with certain health conditions, and increased member engagement with dental care alerts. With our vision, we are the first and only carrier, again, with the bi-directional communication between the vision providers, doctors, and care management professionals. And this applies to disability as well. We have the data sharing between disability and medical care management. We have one of the largest dental PPO networks, backed by Blue Cross and Blue Shield plans nationally. In our dental benefit program, we offer Dental at Work, which is bringing the dental office to the workplace. This is a new partnership with Jet Dental. All of the care is in network and available at a client's office. We also offer Dentures at Home, which is a replacement program for dentures, where the dentures are mailed in a prepaid overnight envelope, and they are mailed back to the member within 48 hours, and the new dentures are made and delivered within 2 weeks. Ortho at Home delivers convenient and affordable at-home clear aligners, and our teledentistry delivers virtual HIPAA-compliant consultations with board-licensed dentists that is done virtually. With our Anthem Vision plans, again, one of the largest networks and a great mix of independent providers and national retail locations. Something new this year is that we are offering discounts on prescription eye drops for myopia, which is also known as nearsightedness, and dry eyes. Myopia is a condition that can cause blurry vision and lead to retinal detachment, cataracts, glaucoma, and even blindness if left untreated. So there are new treatments that are available out there in the market, including prescription eye drops that can help to treat myopia. And if a member sees a provider in our network and receives a prescription, these can be filled through Prism RX as a home delivery, and they can receive up to a 30% discount on atropine. We also have a 30% discount that is available on Total Tears eye drops, and this is for the relief of dry eye symptoms. And dry eye can also lead to eye infections, damage of the eye surface, and even ulcers. So these are two items that we are trying to make more affordable care available to the members to keep from having this condition worsen. Anthem Life, we understand the importance of giving your clients and their employees the benefits that enhance their financial wellness and peace of mind and quality of life. Earlier this year, we announced that the Standard will acquire Anthem's life and disability products and services. And this is going to be a distribution partnership. And we are offering integrative solutions to customers that include life and disability products. And both companies have deep expertise in group benefits administration and shared commitment to customer service. So you will continue to receive additional information on this acquisition as it transpires in 2024. And next, I'm going to turn it back over to Robin so she can talk a little bit more about renewals.
Thank you, Kathy. So just an administrative reminder that employer access is the preferred method of member maintenance. And if you need assistance, you would just email Midwest Employer Maintenance at anthem.com for any additional help. So here's our MEWA renewal action items. Left-hand column is the renewal decision, and the right-hand column is the action that's required. So if you are going to renew as is, then you just need to let your Cornerstone broker advisor know, and they will relay that information to us. If there is a change or add to the current medical plan, you would need to have the signed alternative sheet, administrative benefit change authorization form, as well as any census that would have plan choices if you're adding an additional line of coverage. I'll submit that to the Cornerstone broker advisor. For terminations, we need a letter on company letterhead signed by an authorized signer. Again, send that to your Cornerstone broker advisor. And then open enrollment changes entered on employer access. There is a 30-day window, a 60-day window, 30 days prior to renewal, 30 days after renewal for open enrollment changes. And any of those changes within that time frame would be effective on the renewal date, 1/1/24. If you are adding a line of specialty, be it vision or dental, you would send that to your broker advisor, and the requirements are listed below. I'm not going to read those one by one. And then life and disability, the same. send that information to your broker advisor, and those requirements are listed on the slide as well. On ACA renewal action items, if you are renewing as is, again, inform your Cornerstone broker advisor. You will renew as is unless we hear otherwise. If you're making a change, and that is medical or specialty, that would be your sign rates in the Schedule B, which is the rate table, and that's extremely important to include in any renewal option changes, as the Schedule B lets us know whether it is age rated or composite rated, and submit those to your Cornerstone broker advisor. And then your group termination, again, company letterhead signed by an authorized signer to your Cornerstone broker advisor. And then open enrollment changes entered on employer access, again, a 60-day window, always effective on the renewal date, which would be 1/1/24. Same situation, information that's required for any specialty ads, and just make sure that those are submitted to your broker advisor with all of the completed information required. Grandmothered renewals, we expect the grandmothered and ACA renewals to be in the system in the next week. So hopefully you'll be seeing those shortly. Our base rate increase, as Kathy mentioned earlier, is a 0%. The demographic and experience will impact the overall increase of the group. You as the broker receive the grandmothered option as well as the ACA option from your Cornerstone broker advisor. However, your groups will only receive the renewal, which is the grandmothered renewal. So that's about 65 days prior to the renewal date, which would be about October the 25th. So make sure that if it is the ACA option is attractive, that you share that with your renewal employer. Options at renewal, you can of course keep your current plan and that will automatically renew, but make sure you let your broker advisor know that. If you are going to move to another grandmothered plan, all of the options are included on the renewal. So you will see all of the benefit options on the grandmother renewal. No additional plans will need to be run. And you would just need the next steps renewal decision form that's provided in the renewal packet, and send that to your broker advisor for renewal. If you're going to move to the ACA platform, you would need to have that alternative ACA renewal option signed in order to do that for the group. Those are required 25 days ahead of time, which it would be 12/5 would be the last day that you would be able to move an ACA group to, a grandmothered renewal to an ACA platform, just because we want a smooth transition. And then if you are interested in MEWAs, please talk to your Cornerstone broker advisor to see if that's the right option for the group. We would need to request that information from underwriting if it is a good option. There are a lot of appendix attached to this presentation. Accessing K-Health and Live Health Online virtual Sydney app, portfolio details, which all the details are highlighted in red, or what those changes have been made to the plans, so make sure you take a look at that. There is a network snapshot by plan, so all of the networks that are attached to the different platform plans, ACA, grandmothered, that sort of thing. So that's a great one-page slide. Wellbeing Solutions by plan, again, a one-page snapshot of all of our different platforms and what wellness packages are with those. Pharmacy information, there's a few MEWA.io slides, as well as the form that shows how you locate SOBs, SBCs, and your certificates. So all of those things can be used, and just don't forget to take a look at the appendix, because there is a lot of good information that you can print out and keep as reference. So that is all that we had with the presentation. And I know you might have been collecting some questions. Would you like to, do we have enough time to go over those, or should we send those out at a different time? You let me know, Beth.
No, we have time.
Okay.
Let me So the first question is, can you dual option a grandmother plan with the blue HPN?
No, that is not available.
The second question, could you please list plans the foundational versus engagement packages apply to?
I can take that one. So all of our plans have the foundational platform. So they all offer the listing of, all of the basic programs. The foundational program applies to all of the small group platforms. The Sakamiwa plans and the Anthem Balanced Funding plans also offer the Engagement 200, which provides the opportunity for them to earn the gift cards for doing certain activities.
And Beth, also in the appendix, the Wellbeing Solutions by plan, it lays out which apply there as well. That's why I pointed that out, that's a really good one-page wonder, if you will, on platform.
Okay. The next question is, what is the TLO clause and what is the run-out period for covered claims?
What was the first part of that question?
What is the TLO clause for the balanced funding?
I'm not sure what that's referring to.
It's a 12-12 contract.
And it has terminal liabilities included as well. So if we're not answering, if you want to, whoever asked that question, if you want to give us more specifics, we can try to answer that better if that doesn't answer the question.
I think what they might be asking is, how long does the TLO run out for?
We can check on that. It has the terminal liability. Is that what you're asking about? Is what the
Yeah, I think they want to know how long
time frame is
that in place. Yeah.
Okay. We can check and verify that for you.
Okay. The next question, does a group have to renew the next year to get the 50% back?
So they do have to renew with Anthem. However, if they decide they don't like the level funded plan, they want to move to ACA, they want to move to Sakamiwa, they can still get that surplus back, but they do have to renew on an Anthem plan.
Okay. Why don't brokers have access to the ABF reporting?
They will. That's going to be on employer access, which the brokers have access to.
Okay. Thank you. Oh, on Anthem ABS, how will the surplus be refunded? Through a check, premium credit, direct deposit? Do you know?
Beth, let me verify that, because I'm wanting to say something and then I'm concerned. Let me verify that and get back to you on it.
Okay. The next question is, the ortho home product available for adults or with a discount if not covered by the dental plan?
It would have to be part of the dental benefit to have that. To have orthodontia, it has to be a covered benefit in order for that to be covered.
Okay. What is the length of the terminal? That was already a question. Hold on a second. The grandmother renewals are not currently available on the portal, as the slide indicated, where they move to a different place on the portal.
No, I had mentioned they have not been released yet. We hope that happens in the next week.
In reference to the appendix, does that mean we will receive a copy of these slides as well as the appendix?
Yes. Yes, it's all in one.
And that was the last question.
Okay. We will get back with you on those other 2 questions. So.
If any other questions come through, I can just send them to you then.
Okay. Sounds great.
All right. All right. Well, thanks so much, you guys. And like I said, if you guys have any other questions, just let us know and we will get those answers over to you. Thanks for attending.
Thanks so much for your time.